Well, thank you remotely, Aaron. I appreciate your reminder of the geographic scope of the problem. I assume we have a little bit of time for questions, so I'm going to start with a question of my own for Linda and Andria. What can the federal government do to better let communities and clinicians know about potential exposures to PFAS in their water supplies or potential water supplies?
Linda, do you want to go first? Well, I'll just...
Sorry. Okay. I think I had a little bit of distraction. Go ahead and go first.
Okay. I would just add that what we, in terms of water, what we need from the federal government is the ability to know more about what's in our water. We need to know, we need to be able to have the expanded test methods, detection methods. We need the, and we also need the research going on about more effective and cost-effective treatment for our water, because ultimately we're going to have to get it out of what's already there. We have to get out of. So that's one thing that we need. We need that research. States are trying to move on this, but we can only do so much if we don't have the technology to do it. And there is some effort. I would also say that the medical community at the federal level needs to expand our ability to look for PFAS in the body. As I mentioned at the end of my talk, you know, blood serum is one important source of looking for way to look for PFAS in the body, but that may not be the only place where they're collecting, depending on the PFAS you're looking for.
Linda, do you want to add anything?
Sure, yes. I believe that for our state, I believe that biomonitoring is vital, that it begins to happen, because, you know, people in our community have the right to know whether or not they're being exposed to these chemicals. They have the same right that all the other states that have already done biomonitoring testing or blood testing for PFAS to know more or less what those levels are and how those are compared to other communities. I believe that our community should have that same right. And also I believe that health care officials in every state that is infected by PFAS should have at least one course during their college developments within that career. They should all have some kind of training to understand these types of issues so that they can understand how to treat their patients. Thank you, guys.
So, do we have time for one or two questions from committee members?
Yes, please.
Please raise your hand. I don't see anyone. Does anyone?
So Andria, I had a question. I was actually interested in your issue about organ levels other than blood, and I'm just trying to think of another exposure paradigm where we sample other things, and I didn't know whether you'd fleshed out what that would look like.
Well, I'm not a medical or a biomonitoring expert, but there have been some indications. For instance, there was a cadaver study done in Spain. We were being told that short chain PFAS were not showing up in blood levels, but there was some evidence in that study that they collect in organs. So not sure how you biomonitor that, not being my experience, but that is one thing to look at. Obviously, there are urine studies and other kinds of bodily fluid studies that can be done as well. But that's where that concern came up, that just because we're not seeing something in blood serum doesn't mean that they're not collecting in the body. The other thing to note that's somewhat related, that isn't so much biomonitoring, but is somewhat related, is that if certain types of PFAS, like short chain PFAS, move through the body faster than their long chain cousins like PFOA or PFOS, you need to use more of those shorter chain chemicals to perform whatever function they're performing. and they are constantly cycling through the body into the environment and then coming back to us through the environment. So some researchers have said that what you actually find in a human body on a given day is irrelevant because it's a continuing cycle. So that's another aspect of it.
You know, we sample for arsenic in hair. It's not an organ, but
yeah,
it's non-intrusive, I guess.
Tissue. It's tissue, yeah.
Yeah. Any other questions?
Oh, Chris Wyatt has a question.
Go ahead, Chris.
I'm thinking of other sampling. I wonder, Andria, do you know if, like in the water reclamation projects in California, have they sampled for PFAS there, and have they found it, or if they've been able to successfully remove it from the source water?
So in cases of wastewater treatment, it's very interesting you should ask that. The wastewater systems have recently been given orders to start testing their effluent to see what kind of issues are coming out in their effluent. We anticipate they are going to be a major source of PFAS back into water. And that's important because in this state, and I'm sure this is true in numerous other Western states, because we face drought and water shortage issues, every time a water system, a well is taken offline, we lose a water source. We are looking both at recycled water for non-potable uses, but we are also looking to reclaim water for potable uses. And so there is some discussion within the State Water Board of how are we going to address PFAS as a water contaminant in recycled water. Ironically, recycled water has built into its very existence pretty sophisticated treatment trains that are going to be required to make it potable. So that is probably less of an issue than a regular water system that is not set up to deal with the multiple contaminants that are going to come through a wastewater system. So my own water system, for instance, probably does far less treatment for our regular water sources than it would for its potable reuse sources.
So I know in Orange County that actually is in place now where the recycled water is potable. Do you know if they've done testing in that water and found PFAS?
Yes. So it's actually not allowed to be given as potable water yet because the state hasn't set the parameters. But it is they have a robust potable recycling pilot going on there, as does Santa Clara County, where I live. Orange County has tremendous levels of PFAS in its water. They have a real crisis there where they have upstream sources that have affected their drinking water sources. They are involved in a lawsuit that I know very little about. They're pretty closed-mouthed about it, trying to go after the ultimate makers of PFAS, the companies like DuPont and Chemours and 3M, because of the problem. So they are working with other water systems to try to follow this polluter pay model because of the crisis of their water system. How we're going to treat PFAS is going to be expensive. And one of the concerns we have in this state is because the state is, we have no actual regulations in place. And the regulatory process is moving primarily around PFOA and PFOS. The treatment for that is granulated carbon. The treatment for other kinds of PFAS is going to be far more expensive and far more sophisticated. And we're worried is if the state only goes toward the two chemicals first and doesn't take more of a class approach, water systems like Orange County are going to be faced with having to invest with the least expensive, simplest, this is what's regulated process and make the wrong investments, and ultimately going to have to reinvest in more sophisticated treatment. But they have a very strong crisis down in Orange County.
Thank you.
I live in the same county as Andria, and one of the problems we've had with our recycling water programs is what to do with the brine that's created when we pull the contaminants out of the water, and that's also an issue with the carbon filtration. we used to send our TCE down to an Indian reservation in Arizona to have it burned. So that wasn't a very good solution from my perspective.
And, Martha mentioned that. What do we do with the PFAS after we get it out of our water or out of a product or, out of firefighting foam or whatever? What do we do with it? We do not know how to safely destroy that material. So there's a lot of storage going on. So that's going to be another cost of the treatment.
Linda, I noticed you chatted something. Do you want to add anything? And you have to unmute yourself.
Sorry, talking to myself. The state of Arizona has what's called the waste into tap adopted, I guess, something like where the wastewater is purified and sent to the potable water system, and then it's served to the community. So one of the biggest problems with that is that if the system does not have capacity to remove PFAS, then you've got a big PFAS spread all over your community. Inside two systems have been what they've been using here at the DoD sites in Tucson. So I don't know if you guys are familiar with the inside chew process in cleaning up water pollution or PFAS.
Well, thank you. Thank you, Andrea and Linda, and remotely to Aaron. Maybe he's getting up soon. And I turn this back to the committee.